As we age, many of us encounter changes in our sexual health and desires. Aging is a natural process that brings about a host of physical and emotional shifts, and sexuality is no exception. While it is often a topic surrounded by stigma and misinformation, understanding the intricacies of sexual health and self-pleasure, including masturbation, is essential to fostering a healthy relationship with our bodies and desires in our later years. This article dives deep into 8 essential insights that older adults should know, offering practical advice and emotional support to help navigate the changes in sexual health during aging. Physical changes and the impact on sexual health. As we enter our 70s and 80s, our bodies undergo significant physiological transformations that influence various aspects of our health, including our sexual well-being. Aging is often marked by gradual declines in the efficiency of bodily systems that once operated seamlessly in youth. Among the most notable changes are fluctuations in hormone levels, which have a direct effect on sexual health, desire, and function. Testosterone. Decline in men for men. The natural and steady decline in testosterone levels begins as early as their late 30s or early 40s and continues gradually throughout life. Testosterone is the key hormone responsible for sexual desire and the maintenance of erectile function. As this hormone decreases at a rate of about 1% per year, many older men begin to notice a reduction in libido or sexual drive. They may experience less frequent or intense sexual pleasure, and in some cases may struggle with erectile dysfunction, ED, which impairs their ability to achieve or sustain an erection. These challenges can often lead to feelings of frustration, reduced self-esteem, or even emotional isolation. Menopausal changes in women. Women also face hormonal changes that significantly impact sexual health, particularly around menopause, which typically occurs between the ages of 45 and 55. The drop in estrogen and progesterone during menopause can lead to various physical symptoms that affect sexual health. Estrogen is essential for maintaining vaginal health and sexual function, and its decline results in a thinning of the vaginal walls, reduced elasticity, and diminished natural lubrication. This leads to vaginal dryness, which can cause discomfort or even pain during sexual activity. Many women also report a decrease in clitoral sensitivity, which further reduces sexual satisfaction and pleasure. Circulatory and muscular changes. As we age, blood circulation can become less efficient, and the genital area, which relies on healthy blood flow to achieve arousal, may not receive the same level of circulation as it once did. This reduction in blood flow can make arousal or orgasm less intense or more difficult to achieve. Moreover, aging often results in the decline of muscle tone, particularly in muscles associated with sexual function, such as the pelvic floor muscles. Weakened pelvic muscles can lead to reduced control over sexual responses and diminished sensation during sexual activity. While these physical changes are common and natural, they can have a significant impact on sexual health and intimate relationships. For many older adults, these transformations may trigger anxiety, embarrassment, or feelings of inadequacy, which exacerbate sexual difficulties. However, acknowledging these changes and understanding their impact on sexual health is the first step toward addressing them effectively. Health risks associated with sexual activity in older age. While masturbation is generally considered a safe and natural activity with numerous physical and psychological benefits, older adults should be mindful of potential health risks that may arise as a result of age-related changes and pre-existing medical conditions. Cardiovascular considerations. For individuals with cardiovascular disease or a history of heart-related conditions, it is essential to be cautious when engaging in sexual activity, including masturbation. Sexual arousal and physical exertion can elevate heart rate and blood pressure, potentially putting undue strain on the cardiovascular system. Older adults with conditions such as hypertension, arrhythmia, or previous heart attacks should be mindful of the strain that sexual activity may place on their heart health. Symptoms such as chest pain, dizziness, or shortness of breath during or after sexual activity should be taken seriously, and individuals should consult a healthcare provider to monitor their heart health and ensure they are engaging in sexual activity safely. Arthritis and joint pain. For older adults who suffer from arthritis or joint-related issues, certain positions or repetitive movements during sexual activity can exacerbate pain or inflammation in the joints. Joint stiffness, reduced flexibility, and limited mobility may make it challenging to engage in certain sexual activities comfortably. However, experimenting with supportive cushions or using gentler, slower techniques may help minimize discomfort and reduce the risk of joint strain. Open communication with a partner, as well as a mindset of patience and understanding, can help make sexual activity a more enjoyable experience, despite physical limitations. Medications and their impact on sexual function. Many older adults take medications for chronic conditions such as high blood pressure, diabetes, depression, and anxiety. While these medications are essential for managing overall health, they can sometimes interfere with sexual function, leading to reduced libido, difficulty achieving or maintaining arousal, or delayed orgasm. It is important to be aware of the side effects of medications and discuss any concerns with a healthcare provider. In some cases, adjustments in medication dosages or the use of alternative treatments can help alleviate these issues and improve sexual well-being. Diabetes and nerve sensitivity. For individuals with diabetes, maintaining proper genital hygiene and sexual health is even more critical. Diabetes can impair the immune system and reduce circulation, making individuals more vulnerable to infections and nerve damage. One significant issue faced by diabetics is reduced nerve sensitivity, which can make sexual pleasure less intense or harder to achieve. Regular monitoring of blood sugar levels, managing diabetes effectively, and engaging in healthy lifestyle practices can significantly reduce the risks associated with diabetes and improve overall sexual health. Mental and emotional health. The importance of self-exploration. Masturbation is not just a physical act. It is also an important aspect of mental and emotional well-being. Sexual expression, including self-pleasure, triggers the release of feel-good hormones such as endorphins and oxytocin, which promote relaxation, reduce stress, and enhance mood. For older adults who may experience unique stressors related to aging, such as health concerns, loneliness, or a sense of lost purpose, masturbation can be a valuable tool for emotional balance and personal happiness. Relieving stress and enhancing mood. Masturbation can serve as a natural stress reliever, offering a sense of comfort, relaxation, and pleasure. As we age, we may face increased stress from health challenges, financial concerns, or the loss of loved ones. In these times, engaging in self-pleasure can provide a safe, intimate escape, helping to alleviate feelings of tension and promote emotional well-being. Breaking the stigma. Challenging negative attitudes. Despite its benefits, many older adults struggle with feelings of guilt, shame, or discomfort related to masturbation. These negative emotions are often rooted in societal stigmas or outdated cultural beliefs that view sexuality and sexual expression as inappropriate or irrelevant for older individuals. Many older adults internalize messages that equate sexual pleasure with immorality or weakness, leading to deep-seated feelings of embarrassment or self-judgment. This internalized shame can cause distress and negatively impact self-esteem, mental health, and overall well-being. To overcome these emotional barriers, it is important to foster open conversations about sexual health and aging. Education and awareness can help dispel myths, reduce stigma, and affirm that sexual desire and expression are normal, healthy parts of life at any age. Healthcare professionals and communities play a key role in promoting this understanding, ensuring that older adults feel empowered to embrace their sexuality without fear or shame. Social isolation and loneliness. A natural response to aging. Social isolation and loneliness are increasingly common among older adults, often resulting in significant mental and emotional challenges. Life transitions such as retirement, the loss of loved ones, or reduced mobility can lead to feelings of isolation, withdrawal from social circles, and disconnection from supportive networks. This profound sense of loneliness can drive individuals to seek comfort in solitary activities, including masturbation. Masturbation as a coping mechanism. In the context of loneliness, masturbation can provide a healthy and natural way to fulfill basic human needs for intimacy, physical release, and emotional comfort. While self-pleasure can help reduce feelings of isolation and provide stress relief, it is essential for individuals to maintain a balanced lifestyle that incorporates meaningful social interactions. Relying solely on solitary activities for comfort can further entrench feelings of isolation, making it important to also prioritize relationships and social connections. The changing landscape of sexual health as we age. As we progress through our 70s, 80s, and beyond, the natural process of aging brings about a range of physical, emotional, and psychological changes. Sexual health and desires, often considered taboo or overlooked in older age, remain a vital aspect of human well-being. For many older adults, sexual pleasure and intimacy are not only possible, but can significantly contribute to their overall sense of happiness, vitality, and emotional fulfillment. However, acknowledging and embracing this aspect of ourselves can be complex, as it requires navigating the physiological shifts that come with aging, societal perceptions, and personal experiences. Physical changes and their impact on sexual health aging is often accompanied by a variety of physical changes that can impact sexual experiences. While these changes are a natural part of life, they can present challenges, particularly when it comes to maintaining sexual function and satisfaction. For both men and women, the most significant changes typically involve hormonal shifts, changes in skin elasticity, and alterations in sexual function. These changes affect not only how we experience sexual pleasure, but also how we connect with our bodies and our partners. Hormonal shifts and their effect on sexual desire. One of the most notable changes that occur with aging is the fluctuation of hormones. For men, testosterone, the key hormone responsible for sexual drive, begins to decline as early as their late 30s or early 40s, continuing at a rate of about 1% per year. This gradual decline often leads to reduced libido, difficulty achieving or maintaining erections, and a decrease in the overall intensity of sexual pleasure. The decline in testosterone can also impact mood, energy levels, and self-esteem, further complicating the relationship with sexual activity. Women experience similar hormonal changes, particularly with the onset of menopause, which typically occurs between the ages of 45 and 55. The dramatic drop in estrogen and progesterone levels leads to physical changes such as vaginal dryness, reduced elasticity, and thinning of the vaginal walls. These changes can result in discomfort or even pain during sexual activity, including masturbation. Many women also report a decrease in clitoral sensitivity, which can further reduce sexual satisfaction. These changes, though common, can cause anxiety and frustration, but they are manageable with proper self-care, communication with partners, and appropriate medical interventions. Reduced circulation and muscular changes. As we age, circulation and muscle function also decline. The genital areas, which rely on healthy blood flow to achieve arousal, may not receive the same level of circulation as in younger years. This reduction in blood flow can make arousal and orgasm more difficult to reach or less intense. Additionally, weakened pelvic floor muscles, which support sexual function, can affect both men and women. Pelvic floor exercises, often recommended for those experiencing these changes, can help restore some of the lost muscle tone and improve sexual satisfaction. Despite these challenges, it's important to remember that aging does not eliminate the capacity for sexual pleasure. Rather, it requires adapting to the changes that come with it. Exploring new methods for enhancing intimacy, being patient with one's body, and seeking medical advice when needed can all play significant roles in maintaining a satisfying sexual life. Mental and emotional health, the link between sexual expression and mental well-being. Sexual health isn't just about the physical body, it also involves emotional and psychological well-being. Sexual expression, including masturbation, has been shown to trigger the release of feel-good hormones such as endorphins and oxytocin, which contribute to emotional balance, reduced stress, and enhanced mood. For older adults, particularly those experiencing loneliness, health challenges, or feelings of isolation, sexual activity can be an important tool for emotional fulfillment and stress relief. The role of intimacy in mental health. Maintaining intimacy, whether through self-pleasure or with a partner, plays an essential role in overall mental health. Engaging in sexual activity or masturbation allows individuals to feel more connected to themselves and their bodies, fostering a sense of self-esteem and confidence. For older adults who may feel disconnected or self-conscious about their changing bodies, embracing sexuality can offer a form of emotional release that is empowering and liberating. For many older adults, loneliness becomes a prominent issue as they face life transitions such as retirement, the loss of loved ones, or physical limitations. This isolation can drive individuals to seek comfort in solitary activities, including masturbation, which provides an emotional outlet and temporary relief from the sadness or emptiness they may experience. While masturbation is a natural and healthy coping mechanism, it's essential to strike a balance by actively seeking social connections and engaging in other forms of emotional support. Overcoming guilt and shame. Around aging and sexuality. Despite the many benefits of sexual expression, societal attitudes about aging and sexuality often create barriers. In many cultures, older adults are expected to suppress their sexual desires, and this creates feelings of shame and guilt. Internalized messages that view aging bodies as less desirable or sexually irrelevant can lead to self-judgment, making it difficult for individuals to enjoy sexual pleasure or even embrace their desires. This is where open and honest communication becomes critical. It is important to foster conversations, whether with a partner, healthcare provider, or therapist, about sexuality in older age. Normalizing sexual expression and addressing the emotional barriers that arise from societal stigmas can help individuals feel more comfortable in their bodies and reduce feelings of embarrassment. With the right support, older adults can rediscover and embrace their sexuality without shame. Social isolation, loneliness, and the role of masturbation. For many older adults, the experience of loneliness becomes a central theme in later life. Retirement, the loss of friends and family, and the gradual physical decline can create a sense of isolation. This loneliness can manifest in different ways, and one of the most common responses is an increase in solitary activities, including masturbation. While masturbation is a healthy and normal activity, excessive reliance on it as a means of coping with loneliness can lead to deeper feelings of isolation and further withdrawal from social engagement. The importance of social connections. While masturbation can offer short-term comfort, it's important to recognize that meaningful social connections are essential for overall well-being. The need for intimacy and companionship extends far beyond sexual pleasure. It is rooted in the fundamental human desire for connection. Joining community groups, volunteering, attending social gatherings, or reconnecting with family members can provide much-needed emotional support and reduce the risks associated with social isolation. Maintaining these connections can help foster emotional fulfillment and contribute to better physical and sexual health by increasing a sense of purpose and well-being. Communities and healthcare providers also play a vital role in helping older adults stay connected. Initiatives such as wellness programs, social events, and counseling services can provide opportunities for older adults to engage with others in a supportive, non-judgmental environment. By encouraging social participation, we can help reduce the emotional toll of isolation, improve mental health, and even improve sexual health by enhancing emotional intimacy and reducing feelings of loneliness. Sexual health and communication, strengthening intimate relationships. As we age, the importance of communication about sexual health and desires becomes even more essential. Open, honest dialogue between partners can strengthen intimacy and trust, creating a space where both individuals feel supported in exploring their sexual needs and desires. It's not just about physical intimacy. Sexuality in later years involves emotional connection, mutual respect, and a deep understanding of each other's needs. Navigating physical changes together. The physical changes that come with aging, such as reduced libido, vaginal dryness, or erectile dysfunction, can create challenges within relationships. However, these challenges are not insurmountable. By discussing these changes openly, partners can explore new ways of experiencing pleasure and intimacy, whether through different techniques or finding new sources of connection, like kissing, touching, or simply spending quality time together. Talking about masturbation can help clarify individual needs, relieve sexual tension, and enhance emotional intimacy. Seeking medical support for sexual health. It's also important to seek medical advice when necessary. For individuals experiencing changes in sexual function, consulting a healthcare provider is key. Healthcare professionals can recommend solutions such as hormone replacement therapy, pelvic floor exercises, or medications that help alleviate discomfort or sexual difficulties. Additionally, professional therapists specializing in sexual health can help individuals address emotional concerns, past traumas, or anxieties related to aging bodies. They provide a safe space for individuals to explore their sexuality and work through obstacles that may affect their sexual confidence or satisfaction. Exploring new techniques for sexual pleasure. Aging often brings changes in how we experience pleasure, but this offers an exciting opportunity for exploration. What worked effortlessly in younger years may need a little adjustment, and with a mindset of creativity and openness, older adults can discover new techniques for enhancing their sexual experiences. This might involve experimenting with lubricants, sex toys, or alternative methods of stimulation that align with their current needs. The role of lubrication. For women, particularly those in menopause, vaginal dryness can present a challenge. Using high-quality lubricants can significantly improve comfort and enhance pleasure. There are various types of lubricants, water-based, silicone-based, and oil-based, that cater to different preferences. Water-based lubricants are easy to clean and gentle on the skin, while silicone-based options provide longer-lasting glide. Experimenting with these options can bring a new level of comfort and enjoyment to sexual activity. Sex toys designed for older adults. Mikey. Another exciting development in sexual health is the availability of sex toys specifically designed for older adults. These products are ergonomically crafted to accommodate physical changes, such as reduced grip strength, limited mobility, or discomfort. Vibrators, which come in a wide range of styles and sizes, can provide both external and internal stimulation, catering to individual preferences. Some sex toys also include dual stimulation features, which target multiple erogenous zones simultaneously, offering enhanced pleasure and satisfaction. These innovations allow older adults to maintain a fulfilling sexual life and discover new ways to experience pleasure. The importance of lubrication and medical support. One of the most significant challenges older adults may face regarding sexual health is the natural decline in the body's ability to produce lubrication. For women, menopause brings about a drop in estrogen levels, which can cause vaginal dryness, discomfort during sexual activity, and a decrease in sensitivity. Men, too, may experience changes, such as reduced testosterone levels, which can affect libido and sexual function. To address these issues, lubricants are incredibly beneficial. Water-based lubricants are gentle on the skin, easy to clean, and can provide immediate relief for dryness, enhancing comfort during intimate activities. Silicone-based lubricants, on the other hand, offer longer-lasting glide and are perfect for prolonged sessions. Trying different kinds of lubricants can significantly improve pleasure and reduce friction that might otherwise cause irritation or discomfort. In addition to lubricants, older adults might also benefit from medical treatments and therapies. For instance, hormone replacement therapy, HRT, can help restore hormonal balance and alleviate symptoms like vaginal dryness and reduced libido. Men experiencing erectile dysfunction, ED, may find treatments such as medications, vacuum pumps, or even penile implants useful in regaining sexual function. Moreover, pelvic floor exercises, whether Kegel exercises for women or other strengthening exercises for both genders, can improve circulation, enhance sexual response, and help regain muscle tone that is often lost with aging. Consulting a healthcare provider about any physical changes or sexual health concerns is important. Medical professionals can provide personalized advice based on one's health history and can recommend solutions to ensure that sexual activity remains a positive and enjoyable part of life. Exploring new avenues of intimacy. Sexuality in older age is not only about physical changes, but also about deepening emotional bonds with a partner. As our bodies evolve, so too should our approach to intimacy. Embracing new ways to connect emotionally and physically can lead to enriching and fulfilling sexual experiences. This might involve exploring different forms of touch, like massages, or experimenting with new forms of affection that focus on emotional closeness, such as cuddling or holding hands. Many older adults find that they no longer prioritize intercourse, but instead enjoy the slower, more intimate expressions of affection that involve deep connection and trust. Open and honest communication with partners becomes even more important as we age. Discussing needs, desires, boundaries, and any changing physical limitations can enhance both emotional and physical intimacy. When partners communicate freely about their evolving bodies and preferences, it fosters mutual respect and understanding. This helps individuals feel supported and comfortable in their own skin, leading to a more satisfying and nurturing relationship. Partners may also find that the experience of intimacy itself evolves over time, with more emphasis on quality rather than quantity. Sexual experiences may become more focused on pleasure rather than performance, allowing couples to enjoy their connection without feeling pressured. Embracing this shift can transform the experience of intimacy into something more rewarding, where the focus is on emotional connection, shared pleasure, and mutual respect. The role of masturbation in older age. Masturbation remains an essential and healthy practice in older age. For many older adults, it serves as a source of stress relief, promotes relaxation, improves sleep quality, and can boost self-esteem. The physical act of self-pleasure can help individuals reconnect with their bodies, understand what brings them pleasure, and maintain sexual function. Despite societal stigmas around aging and sexuality, masturbation is a normal and beneficial activity that can enhance both physical and emotional health. Exploring self-pleasure with a spirit of curiosity rather than shame leads to greater self-awareness and confidence. Learning what feels pleasurable at any given stage in life can help foster a deeper understanding of one's own desires and needs. Self-pleasure allows individuals to take control of their sexual health and experience moments of personal joy, regardless of their age. For those with partners, masturbation can also be a complement to shared intimacy, offering a way to relieve tension or even to experiment with new forms of pleasure. It's also important to emphasize that masturbation in older age can continue to be a source of empowerment. With time, older adults may discover new techniques that feel more fulfilling or explore the use of toys or other aids that can enhance their self-pleasure experience. The goal is to embrace self-exploration with openness, without guilt, and to appreciate the evolving nature of one's sexual identity. The emotional and psychological benefits of intimacy. The psychological benefits of maintaining a healthy sexual life, including masturbation, extend far beyond physical pleasure. Intimacy in later years provides a sense of connection, belonging, and purpose, all of which are vital for emotional health. Whether enjoyed alone or with a partner, sexual activities help trigger the release of feel-good hormones like endorphins and oxytocin, which contribute to improved mood, reduced anxiety, and overall emotional well-being. For many older adults, intimacy reminds them of their own vitality and the profound need for touch and connection that is deeply ingrained in the human experience. Embracing this aspect of ourselves, regardless of age, fosters a sense of self-acceptance and joy. When individuals feel confident and empowered in their sexual identity, they are more likely to enjoy other aspects of life, such as relationships, career, and hobbies, contributing to a more fulfilling and meaningful existence. Navigating loneliness and the need for intimacy. For those who are single, widowed, or navigating new relationships, honoring sexual desires becomes just as important as physical self-care. A healthy sexual life in older age can fulfill emotional needs, creating a sense of intimacy and closeness that may otherwise be lacking. Many older adults find solace in their own self-pleasure, which can serve as a form of self-care and stress release when meaningful social interactions are not readily available. However, it's crucial not to let self-pleasure replace the need for emotional connection with others. Building a fulfilling sexual life, even in later years, is about striking a balance between honoring one's own desires and maintaining relationships that foster emotional intimacy. Older adults should feel empowered to explore relationships at their own pace, whether it's through online dating, reconnecting with old friends, or cultivating new friendships in social settings. This openness to intimacy, whether physical or emotional, enriches the overall quality of life. The impact of social engagement on sexual health. Social isolation can have profound effects on one's emotional and physical well-being, including sexual health. Loneliness and social withdrawal can lead individuals to focus primarily on solitary activities like masturbation. And while this can provide temporary relief, it's essential to seek opportunities for deeper connections. Engaging in social activities, joining support groups, or volunteering can reduce feelings of loneliness, promote emotional fulfillment, and increase the overall sense of well-being. Communities and healthcare providers play a critical role in supporting older adults by creating spaces for social interaction and providing opportunities for emotional connection. Regular social engagement reduces the risks associated with loneliness and isolation, and it helps prevent the negative psychological effects of prolonged solitude. Establishing strong social bonds can enhance one's mental health, encourage a sense of purpose, and even positively influence sexual well-being by reinforcing emotional intimacy. Sexual health as an ongoing priority. As we age, it's important to continue prioritizing sexual health. This means seeking professional advice when necessary, addressing any health concerns, and making proactive choices that promote a satisfying and safe sexual life. Healthcare providers offer invaluable support in addressing any physical, psychological, or emotional changes related to aging and sexuality. They can offer solutions for managing medical conditions, such as erectile dysfunction, hormonal changes, or physical discomfort, and can provide recommendations for maintaining sexual function and pleasure. For many, understanding the implications of aging on sexual health, staying open to change, and prioritizing communication and wellness can transform the experience of intimacy into something incredibly fulfilling. With the right mindset, older adults can continue to experience a rewarding and satisfying sexual journey, grounded in self-awareness, self-love, and a deep connection with their desires and needs. Conclusion: embracing your sexuality throughout life. In conclusion, sexuality remains an essential and fulfilling part of life, regardless of age. As we age, it's important to embrace and celebrate the changes that come with our bodies while continuing to honor our sexual needs and desires. By maintaining open communication with partners, exploring new techniques and tools, and seeking professional support when needed, older adults can continue to enjoy a rich and satisfying sexual life. Sexuality in later years can take on new meanings, focusing on quality rather than performance, and offers opportunities for deeper emotional and physical connection. Embracing self-pleasure, fostering intimacy, and prioritizing sexual health all contribute to a fulfilling, empowered life as we age.